All right, people are just coming in and we're going to get started because I know that we all have busy schedules and things to attend to, but thank you so much for tuning in today for this webinar with the COVID Collaborative. My name is Julie Tesh and I am President and CEO of the Center for Rural Policy and Development. We are a 501c3 nonprofit organization that focuses on research on rural Minnesota issues. And so we're happy to be the convener today and bringing together a great panel for you. To give you just a little bit of a background on the center, you can check out all of our research. Our research is free for you to use at ruralmn.org. And reports, we have podcasts, we have blog posts, videos, the whole 9 yards. And the whole goal is to take important issues from rural Minnesota and make them clear for people to understand. So kind of like COVID, you know, here COVID is affecting everyone greatly, but in rural areas, it is affecting us a little different. So we take that data and that research and put it into usable reports and information. So I encourage all of you that are online today to take a look at it. Again, ruralmn.org. So we're happy to have you all here today. I am going to mention today that if you would like to participate in the chat or have any questions, please put that in the chat function. We do have somebody who is moderating the chat window, so please feel free to do that. And we're going to get started right away because we have very important information to get to. So thank you again for all of you being here today. Oh, and I should also mention that this is being recorded and that this will be available on the Center for Rural Policy and Development on our YouTube channel, probably by the end of the week. So you can go back and reference that video. So with that, I am going to turn it over to Brian McClung.
Hey, thanks so much, Julie. And thanks again to the Center for Rural Policy and Development for serving as the convener and host of this really important conversation. Really glad to have you as a partner in this effort and this outreach. I'm Brian McClung. I'm the co-CEO of Park Street Public. Our firm has been working with the COVID Collaborative for the last couple of months to bring this together and to bring together a broader coalition of partners and organizations around Minnesota to continue to battle against COVID-19. And we know and recognize that this pandemic is not something that is just going to be easily stopped and put behind us. It's going to take all of our efforts to come together and continue to emerge and grow and come through all of this together. And so just wanted to share a little bit about the COVID Collaborative and their efforts. The COVID Collaborative is a diverse and comprehensive team of leading experts in health, education, and the economy, working to support state and local leaders across America in the fight against COVID. It's really a group of private sector individuals, nonprofits, people from academia, really from across sectors that have come together to support what governments are doing in this effort to fight COVID. The COVID Collaborative is working particularly in 5 states on the ground to increase vaccination rates and to build this kind of coalition and this team that can continue to get this important work done. And Minnesota is one of those key states. And so we're glad to be able to join together and work on that. The COVID Collaborative has also partnered with the Ad Council and trusted rural voices like the American Farm Bureau Federation, the Cooperative Extension System, and others to put together some PSAs that feature and speak to rural Americans from across the country. So we encourage you, if you'd like to learn more about that, to check out the COVID Collaborative's website, see those videos, look at the resources. It is really a wealth of information there that we can all use and share within our networks wherever we are. And so that's why we all came together with this as kind of a cornerstone event of the efforts here, which, like I've said, we've been working on for the past couple of months. And we look forward to continuing to grow on that effort in the coming months. So if this is something that you or your organization would like to get more directly engaged in, I encourage you, reach out to the Center for Rural Policy and Development, reach out to myself or Christina Palladino at Park Street Public, and we would love to have you join us in those efforts. So with that, I'm going to introduce my friend and colleague, Christina Palladino. She's moderator for today's event. We've got a great conversation coming up here. And again, if you have questions or thoughts, use that chat function. That'll be monitored, and we'll pass that information on to Christina during the conversation. So again, thank you all for joining. And Christina, I'll hand it over to you.
Great. Brian, thank you so much. I'm Christina Palladino. As Brian mentioned, I'm the Senior Principal of Communications and Media Relations here at Park Street Public. I'm very excited to be participating in this virtual event this afternoon. It is so timely with what is happening in our healthcare systems right now with the virus impacting people all across our state. And again, as Julie and Brian mentioned, we are recording this, and please feel free to send questions our way. I really like to get interactive in this discussion. Please make sure you use your name, your title, and the organization you're with, because I really think it helps make this whole conversation organic. So I just kind of want to bring us up to speed here of where we're at in Minnesota in terms of the pandemic, some of the news headlines coming out actually this morning that are pretty startling. As you see on your screen there, as of Monday, Minnesota had the nation's third highest rate of COVID infections. That's according to the CDC. Minnesota's positivity rate is 11.5%, an indicator of widespread transmission. 84% of the state's hospitals have 0 ICU beds available. And today in Greater Minnesota, there are a total of 16 ICU beds available. Some other information, according to the Minnesota Department of Health vaccine dashboard data, more than 3 million Minnesotans have received at least their first dose statewide. Of course, we know our state's northern and central counties have been hit hardest by this recent September through December surge. Between October 3rd and November 6th, there were 368 unvaccinated Minnesotans who died from COVID, compared to 289 who were vaccinated. That's a disproportionately high number of unvaccinated deaths, considering the unvaccinated comprise just 27.4% of Minnesotans over the age of 16. Unvaccinated people are 29 times more likely to be hospitalized with COVID than those who are fully vaccinated. The study also found that unvaccinated people were nearly 5 times more likely to be infected with COVID than vaccinated people. So I want to bring in Tim Houle. He's the Crow Wing County Administrator. He's been in county government for a really long time, just to give us about a 10-minute or so overview from a county professional's perspective, kind of a 360 perspective, just reflecting back on the last 2 years on what this pandemic has done to a rural county here in Minnesota. Tim, as the county administrator since 2008 and a decades-long career in county government, how has the COVID-19 pandemic impacted rural communities in ways that you've never seen before?
Thank you, Christina. Thanks for the question, and welcome to all the folks on the webinar today. I think it goes without saying that COVID has had dramatic impacts in rural Minnesota, and I don't know how you could live out here and not have experienced them. I'm going to talk a little bit about the different kinds of disruptions that I think we've experienced, and try to put them in maybe what I think is kind of rank order of priority from lowest to highest. First, supply chains. I think we've all experienced supply chain disruptions, and that has affected everybody. It is certainly an inconvenience to all of us. And I suspect, depending on how close you are to a shortage, it may be more than an inconvenience. It is probably one of the contributors to inflation that is happening at the current time. It impacts not just the local economy, but the entire economy in general. We've experienced those kinds of disruptions in Crow Wing County. Disruptions in tourism, in the tourism industry in particular. For Crow Wing County, it's a big deal here. We live in the heart of Minnesota's lakes area. And that tourism industry in the early days of COVID, probably it did dry up to nothing for about 4 to 5 months. If I was looking in the early days of the pandemic, I would say that the unemployment rate in Crow Wing County was probably about 25%. What we really had was workers were safe, but they were unemployed. Now, did that affect worker loyalty and drive some of the employment churn that we're experiencing in the labor market today? I'm not sure, but it makes me wonder. After reopening, however, the story is a different story. We had a better year than normal as Minnesotans stayed closer to home. So our sales tax revenue never declined. We thought it would. Our gas tax revenue, which we thought was stable, that did decline 15% as people were working more from home. And so there were some unexpected kinds of twists to the revenues. I do think in sales taxes, we probably saw a congregation of sales in more of our big box stores than we did in the small ones. Crow Wing County did grants to businesses and nonprofits to try to cover some of those losses, but ultimately nothing we could do was going to be enough to offset the early losses that people experienced. I think we also saw disruptions in the retail industries. That affected everyone. Obviously, going to the grocery store became a slightly different thing than it used to be. And we all got to eat. So there are certain retail things that we all still had to keep doing. And the challenge there was trying to keep workers safe. We still needed to survive. So we had to take some calculated risks. We tried to deal with that with the available tools at the time. And you may recall that was normal public health advice for any kind of respiratory illness. Wash your hands, socially distance, wear a mask. In Crow Wing County, we went and tried to make that a little bit more of a county initiative under the umbrella of Lake Country Cares. So we volunteered our public health team to review business plans to reopen when that was at issue. We have some promotional materials and billboards and trying to just lighten it up a little bit. So instead of saying social distancing, we said, stay 2 axe handles away from the nearest lumberjack because we live in Paul Bunyan land. So trying to lighten the way that we're talking about this. The early tools and the PPE, that was really difficult, but we did manage, we came out okay. Another sector that I think got affected was manufacturing. And in manufacturing, I think it affected different businesses differently. And it depended on the congregation of employees. How congregated were they in order to perform their tasks? We had some manufacturing that could scale up, or there were some that had to scale back. Obviously keeping workers safe, but we still had to have jobs. We all still had to pay our mortgage. We all still needed to go to work. And so they did as much as they could to distance employees. Sometimes they required masks to be worn. They had to take calculated risks. The other industry that I think has been dramatically affected is our school systems. It has created sporadic, unplanned outages and quarantines, in particular, that required parents who don't normally need childcare. Think about a 4th or a 5th grader. The only childcare that you needed was after school. And so you might have an after school childcare arrangement already made, but when school let out unexpectedly and sometimes only on very short notice, that made parents scramble in our community trying to find childcare for a child that they normally did not need childcare for. That caused absences from workplaces throughout the county where parents had to stay home to care for children. Sometimes they could work remotely, but not everybody could work remotely. So depending on the age of the children, it made a difference. Sometimes you could work from home, but not always. It's very hard in a school setting. It's such a congregate setting. It's very hard to socially distance. They are trying. Distance learning, I think we know it's okay, but I do get concerned that we may leave an entire generation of school students further behind because distance learning, I think a lot of folks would agree, is not as good as in-class learning. And so now we're trying to sort of force the in-class learning because we know that that's the better way, but the disruptions caused by positive COVID cases, teachers who may be out, unplanned absences. It's the unplanned nature of the impacts here. I can run county government and I can plan for things that I know are going to happen, but it is the unplanned absences that really send me, manufacturers, retailers, school principals scurrying, trying to plug the hole in the dike. And so for schools, I think this has been a particularly challenging couple of years. And We see that it is not necessarily the most popular time to be on a school board right now. And I think probably a lot of our webinar listeners who may serve in elected capacities could relate to that. The other industry that I think got significantly impacted here is nursing homes. Here too, it's a congregate setting. It is hard to create social distancing in a nursing home. So they ended up creating COVID wards. They would congregate all of their COVID patients in 1 or 2 or 3 wings of the building. We couldn't see our parents and our grandparents who lived in nursing homes for over a year. Just let that sink in for a bit. We couldn't see our family for a year. Nursing homes suffered some of the highest mortality rates. 1 out of every 100 people in this country over age 65 has died of COVID. They are suffering high rates of staff burnout that is attributed to a variety of factors. One of them is watching and caring for so much suffering. They could not let families in. People were dying completely alone. The staff was their family. And we had staff shortages that are probably caused by the labor shortages that are going on in our market right now. So much so that we had to bring in the National Guard to staff nursing homes in rural communities that could not retain or muster a qualified staff to staff the nursing home on any given day. Simultaneously now, we are living with labor shortages. New unemployment claims right now, as I understand it, are the lowest we've seen since 1969. That's a whole different webinar, baby boomers and labor shortages. But given the retirement of the baby boomers, I'm going to argue this labor shortage isn't going away anytime soon. We're not done experiencing it because baby boomers are still retiring. That's going to continue to create challenges in the labor market. Hospitals, I think, were also dramatically affected. Again, a congregate setting of people, but here it's people who are already sick. We couldn't visit our families in the hospital, some of whom never made it home. They suffered the second highest mortality rate of any industry. The highest rates or high rates of staff burnout, as these folks have been dealing with over capacity, over stress beyond the norm for over 2 years now. Mandatory overtime, extra shifts that they have no choices about because they can't muster enough of a workforce. And that is a serious limiting factor in how many beds they can make available. Both COVID and the labor shortage are hitting them simultaneously, making fewer beds available when we need about 30% more beds. That labor shortage, I think, is not going to change anytime soon. Hospital caregivers are burnt out on the suffering and death that just keeps happening. They largely view it as avoidable. I read an interesting op-ed from a local doctor who said that that's the conversation that happens among the nursing staff. They view it largely as avoidable. Oftentimes I hear from folks in that setting that it's getting harder and harder to care for people who, only after they've been admitted to the hospital or the ICU say they wish they had taken the vaccine. And I have a personal example of that on our own county board. One of our commissioners, Commissioner Paul Coring, has been very public about his experience. He's not an anti-vaxxer. He never was. I would count him as a vaccine skeptic. He's 58 years old. He had no pre-existing conditions. He ended up in the hospital in the ICU, and frankly, he very nearly died. By his own admission, he says now that if someone would have told him that even though he might have gotten COVID, he wouldn't have had to go to the hospital or wouldn't have had to experience an ICU visit, he might have been more likely to get the vaccine. You can check out his story online. Paul Coring, you Google it, you'll find it. It is probably the most compelling story I've ever heard from a public official who laid himself so bare. It is really a compelling read. I encourage you to look it up. Commissioners elsewhere, significant other now has long hauler syndrome, got it before vaccines were available, got it from working in a school system, may live with it for the rest of his life. No one knows. And I think that's what's really troubling about this is the things we don't know about COVID are still legion compared to the things we do. And so why does someone have a bad experience and someone else doesn't? I don't know, but it worries me because I don't know. In summary, for Crow Wing County and our 2 hospitals, we're blessed to actually have 2 hospitals in our county, 100% of the ICU beds are filled with COVID patients. In other hospitals, as Christina said, 84% of the hospitals statewide have no COVID beds available. I'm told from hospital officials about 90% of the folks that are occupying those beds for COVID-related reasons are unvaccinated. The issue in our community today is the continued disruptions mentioned above. Most importantly, hospital capacity for our normal rate of illness. I'm old enough that I figure I might have a heart attack at some point in time, and I'd really like to make sure there's an ICU bed available for that when and if I have that. Minnesota just topped 10,000 deaths today. There were more deaths in 2021 than there were in 2020. The elderly have clearly suffered disproportionately here and tend to have the highest rates of underlying conditions. It clearly puts them at higher risks of mortality. Those perishing under age 65 without any pre-existing conditions are almost exclusively unvaccinated. You can still get COVID after being vaccinated. I've certainly heard that cited as a reason to not get vaccinated. It is true. You can get COVID after getting vaccinated. No vaccine is ever 100% effective. But consider this, as Christina pointed out in the beginning, unvaccinated people age 65 are 5 times more likely to get COVID than vaccinated people of the same age. For those over age 65, you're 6 times more likely to get COVID if you're unvaccinated. Unvaccinated people under age 65 are 16 to 17 times more likely to be hospitalized compared to vaccinated. Unvaccinated people over age 65 are 11 times more likely to die from COVID than those who are vaccinated. We have data now to support that this vaccine is working. You don't vaccinate yourself only to protect yourself, but the odds are clear that vaccinating gives you much better odds than the risk of COVID or the risk of a side effect from the vaccine. The odds are very clear now. You do it to get rid a community of the kinds of disruptions that we're experiencing across the full spectrum of our lives. And I would argue that we will continue to experience these disruptions for as long as we now choose. There's nobody coming into our communities from the outside now causing these disruptions. We're doing it to ourselves. Getting vaccinated is how we stop it.
Thank you so much, Tim. Really powerful and really well said. And with that, I want to bring in the rest of our great panel for this discussion. I want to introduce everybody on this panel. If everybody could turn their videos on, that would be great. And it looks like we're already getting questions from our audience. That's awesome. So I'd like to go around and introduce everyone very briefly. We have Paul Hoppy, Director of Public Safety for the City of Wyoming. Uni Beal, a 3rd-generation dairy farmer and president of the Fillmore County chapter of the Farmers Union. Pastor James Alberts, CEO and founder of Higher Ground Church of God in Christ, as well as the CEO of Higher Works Collaborative in St. Cloud. And Andrea Roberts, certified registered nurse anesthetist and president of the Minnesota Association of Nurse Anesthetists. Thank you everyone for being a part of this discussion. So I wanted to just start off with a round robin of the panel, and in a minute or so, just tell us why you wanted to participate here. Andrea, I'll start with you.
I wanted to participate because I love my community and I love my colleagues, and I think education is key to stopping this pandemic. Educating about what prevents the spread and how to keep yourself safe. And if, by golly, you do get COVID, how to minimize those symptoms. So here I'm just speaking from my heart because I truly believe in our mission.
Great.
Thank you.
Uni? Oh, I think you're muted.
Well, thank you for asking me to be on the panel. Many of our friends and neighbors whom I've talked to have gotten the vaccine and the booster in our rural area, especially the elderly residents. We live in an area, though, that's where the Mayo Clinic, Olmsted Medical Center are fairly close. And many people in the surrounding communities work at these clinics and hospitals. As a result, people trust the scientific knowledge of medical professionals. I worked at Mayo Clinic graphics department for over 27 years, and we took the scientific research that doctors brought to us and turned it into information that people could understand by creating posters, booklets, and slides. One example is that since the 1990s, the SARS virus was researched extensively. And that knowledge was the basis for developing the COVID vaccine so soon. I have a great deal of trust and respect for our medical institutions. And one memory that stands out in my mind is when I was in elementary school. The polio vaccine was just came out, and all the children in the schools were vaccinated in school. My mother had a sister who was handicapped because of polio, and it was not questions. We were going to get our vaccine. And as a mom, I took all my children to get all their vaccinations. Thank you.
Yeah. Pastor Alberts.
Good evening or good afternoon, and thank you for allowing me to be on the panel. I'm here to continue to advance the education of everyone around the need for these vaccinations and for the populations in greater Minnesota, the 7-county metro area, and really anywhere where we need to get this information out. This is a worldwide pandemic, and the effects of it have now lasted multiple years. It is the challenge of our generation, and it is something that we need to overcome. But the only way that we're going to do it, I think that has already been said, and it will be said again through this entire presentation, education is key. And we need to continue to spread the appropriate right news and the right information so that people can make adequate and effective decisions about their healthcare and their future and the future of their family and loved ones. Thank you again.
Thank you. Chief Hoppy.
Thank you for inviting me. I think it's important that, as we go through this as a community, the police and fire, a lot of times in the organizations I represent are those community conduits. We touch so many different facets of everybody's life. And from our perspective, a lot of times what we see is people's personal experiences are sometimes limited. They don't maybe have that broad experience as this panel does. To really help them find the right information to make the decisions that they need for their healthcare. We see a lot of people in the community is relying on misinformation that's out there, and sometimes they just don't really know where to go to ask, what is the real information? Who are the people that are affected because they're not necessarily in their circles, and how does it affect each of our professions, our industry, our neighbors, our friends, our families? And some people just don't have those experiences yet. But I think being involved in a panel, a broad perspective panel like this, and giving people the opportunity to ask the professionals, to ask the people in their communities in a variety of different civic organizations, I think is extremely important to really try and get the information out there and how it affects all of us as a community. Because that's really what we're dealing with this and why it's a pandemic, because it's not specific to a person, not specific to a home, not specific to a region or a city. This is really a national community-wide issue. And I think we really have to look at it from that perspective and what we can do to participate and help change the outcomes by getting the right information out that helps our community as a whole make educated decisions in their own healthcare that affect all of our neighbors.
Excellent. So Andrea, you're our healthcare professional here on this panel. You've been treating COVID-19 patients since day one. Explain to us why this time around it's so drastically different and extremely frustrating for nurses and doctors.
There are a few reasons. The last time, or the first time the pandemic hit, we didn't really know how to prevent it, how to go forward. We're all waiting for that magic cure. What we know now is how to stay safe, how to prevent the spread, how to minimize the symptoms. We know that universal precautions, meaning washing your hands, wearing a mask, if you're ill, stay home, socially distance, stay physically and mentally healthy. It's very important. And to get vaccinated, the vaccination does work. Right now, going into this, healthcare workers, we're spread thin. We're going into this already with emotional fatigue. And the population that we're seeing is changing. It used to be the over 80 population or the 65 to 80. We're seeing younger patience with it. I can speak from personal experience of my two youngest children have been vaccinated and they still got COVID. But I'm so thankful that they had that vaccination because their symptoms were quite mild compared to what it could have been. So we're going in stressed. We are short-staffed. We have an expanded scope of practice for every practitioner. We're so used to just doing our one little job and staying safe, but now we have nurses who are expanding into ICU roles. We have nurse anesthetists who are that extra set of skilled hands for those ICU nurses. We're also seeing the nurse anesthetists going into the ICU as advanced practice nurses and helping our physician colleagues and advanced practice nurses on how to manage those airways and how to manage the sedation and the hemodynamic stability, meaning blood pressure and vital signs. Emotionally, it's stressful. We may be the last person that gets to talk to that patient before we place that breathing tube. And we don't know if we're going to be able to remove that breathing tube. We're there to not only comfort them, but to send those messages of comfort to their family members as well. So there's just so many different variables that come into this. We now have masks available. When the pandemic first started, we didn't know that we were going to have to use so many masks, but to two, where a supply chain was going to come from. How are we going to keep up with it? Now we're wondering, how are we going to have enough ICU beds? How are we going to have enough ventilators? And those are the breathing machines that keep people oxygenating and perfusing while they are sedated. The other thing that we're seeing is that the rural hospitals are seeing higher acuity of patients, meaning the sicker patients. And the reason for that is because we are sending and shipping our intubated and COVID patients to the larger hospitals. So in return, they're asking us to keep patients that maybe we would normally send to a higher level of care. And so the learning curve just among staff is different there as well. And then you look at elective surgeries. Doing a day surgery is okay, but if you want to schedule a surgery for a patient, you have to look and see if there's potential for them to stay overnight. And is there a bed available for that patient? If not, you can't do those types of surgeries anymore. So that's frustrating. People who need certain things can't get it taken care of right now. And people just don't stop getting sick because there's a pandemic. We still have to deal with people who are having those heart attacks or are sick with some other type of disease that's going on or process, and they still need to be taken care of. So when we say that there are no ICU beds available, they're filled with COVID patients and other patients who are continuing to have normal sicknesses there going on. And I could probably talk forever about all the different challenges we have here. But I can tell you that I'm so thankful for colleagues and for community members. We're resilient and we're working together and we're hoping to continue to educate so that we can keep everybody safe. And just from a rural perspective, the patients that we're taking care of, they're the people that we see at the grocery store. They're our neighbors, they're our colleagues' family. It's very personal to us, and it just puts a deeper level of responsibility on you to take good care of those patients.
And just that makes me think, can you describe a conversation you've had with somebody that you know that may had heard from a Facebook group or some sort of misinformation that maybe you've been able to change their minds about getting vaccinated, or at least had them maybe consider it? Have you had those conversations in the last couple of years or months?
Those conversations all the time. And there are two different conversations that you have. You have one side who say, but I don't see that. And that's where you can educate and say, but I'm in healthcare and I do see this. So even though you haven't, thank goodness you haven't seen this, but let me tell you how bad it can get. And then educating them on what happens there and what your risk is there. And then the other conversations I've had are those who say it's my body, my choice. And it's to gently educate them because you're true, it's your choice. But I think that they are concerned about being mandated. And so it was maybe the rollout of how it was done if you communicate and educate and not only just normalize the conversation, but humanize that conversation. So let's bring it down to a personal level and what this means. What is your social responsibility? What is your responsibility to yourself, to your family, and for the greater good? And you can have those conversations without getting angry or upset or politicizing it. Just let me hear from you, talk to me, and then truly listen to them. Don't be so quick to judge. Don't be quick to say, oh, but this is the way it should be, but to truly listen to what their concerns are. And I think we can learn something from that and then take that in the education. And if you're more willing to listen to them, they're more willing to listen to you as well. So I truly think it's how you present the information. And again, you know, I'm an educator on top of a clinician, and I think education is key. And it starts with our community, it starts with our family, and it continues on through our colleagues.
Great. Chief, you're someone who's also working on the front lines. You oversee the police and fire departments in Wyoming. We know more than 460 law enforcement officers have died nationwide from COVID, far more than any other profession. From your perspective, why do you think it's been difficult persuading officers to get vaccinated?
We're certainly subject, our industry is certainly subject to everything that, the rest of society is. I mean, you couldn't have asked for a worse time for this pandemic to come, because we were so politically polarized and divided that, it really became, in the infant stages of it, a political issue. And when we take that and we talk about the communication, and I love the question down below, someone tagged in the flyer for, misinformation, information from the Surgeon General. And I think there's just simply a distrust of our federal government right now at the highest level. So even those great links, there's skeptics, right? There's skeptics across our communities. And there's no greater skeptics than law enforcement. I mean, that is the nature of our employees, is to be skeptic, right? We want the hard evidence. Our job is to go seek the evidence, to investigate, don't take things on the surface, understand it, dive into it, and don't believe it until you can prove it. I mean, we're right on the edge of science sometimes. And I think when you take those characteristics and you look at the polarization of the issue, a lot of our staff are in that same boat where they're skeptic. They don't know if they should take it or not going to take it. What's the long-term effect? What's the short-term effect? How is it going to, impact me long-term? And so they're skeptic. That's the nature of who they are. They make good law enforcement people with that characteristic. But then you also take our industry, and we're the first line to all of this. And when the medical call comes in, we send police, we send fire, we send EMS. And so we work in a non-sanitized, sterile environment. We work in people's homes. And so we're right in the mix of it before they ever make it to the hospital. We're engaged in it. And then you look at some of the characteristics of, law enforcement, which is our culture. A lot of our industry is centered around what we call the macho image, where it's a mentality of, it's not going to affect me. It's not going to happen to me. I'm the resilient one. I'm the one that runs to danger, not runs away from it. So you have to kind of break through that thought process in itself. So when you start to, build all these different just layers right in the culture of who we are, and then you go into the next layer of communication. One of the best tactics that we have from controlling scenes and controlling people is really, it starts with appearance and officer image, right? We show up, we have that level of authority. They don't like to hide behind the mask. They don't want to be behind the mask, because it sends a different physical image that a lot of times will compromise what their control is, right? And then I think if you go even one step beyond that, we talk about communication effectiveness. And how we communicate. It's simple, easier to communicate with people who sometimes have a tendency not to hear well, right? Who struggle with hearing impairments, and we can put that into certain demographics of the population who are most affected by COVID. And so we've trained over years and years, to understand that people that can't hear well want to see the lips move. Well, let's mask it. And so we lose that communication with that elderly population who's also, highly affected by it. So I can't say that it's one thing, like, why aren't we doing this? I'm going to say it's a totality of everything that simply makes it a challenge for our industry to accept the fact that, you need to be acceptant to the fact that, you're not resilient to it, that you're not immune to it. And then you need to change your communication styles. You need to change your appearance and officer presence, command presence style, because it does affect that as well, because it makes it look like you're hiding behind something. You need to accept, some of the truths that are out there, not be quite so skeptic of it. So we're basically asking our staff to kind of go back on everything that their belief systems, and just simply adapt it out of faith. And I think that's one of our challenges. And then we put them out in the environment that is non-sterile. And we tell them, go into every single medical, be the conduit, go in there. And, the medical staff and ambulance people are really good about PPE and masking up. We're simply not. It just hasn't been within the culture of our industry to do that. We'll put the gloves on, but, unless it's a biochemical, and we can put on our big heavy masks, it's simply, a lot of times they forget it in the car because they're fast to respond. They're quick to respond. They don't take the time to think, okay, I got a PPE up, I got to grab a mask, I got to put my gloves on, I got to put all of these things on before I respond in there. So, when you take all the totality of all of that, culture, characteristics, personalities, and environment, we're simply just at risk, period. And it affects us greatly as a result of it.
Yeah, it's a really interesting way of thinking about it. We know there has been vaccine hesitancy, particularly in the BIPOC community. Pastor Alberts, talk about some of the grassroots efforts you and your church have done to help people become more comfortable with getting the vaccine.
We instituted several clinics from our church, and actually collaborating with several other congregations within our Tri-County area where we are. We handled over 200 vaccinations at the height of the pandemic spreading out. And we have ongoing educational and vaccination opportunities that we have made our church available as a site to be able to do that with. In the BIPOC community, we have historical things that have played a part into kind of an untrustworthiness from different institutions and organizations that make it such that at a certain generational level, there's an unreadiness to just do what is being told to you to be able to do. And so that's a challenge. But I think one of the other challenges too comes into play when you look at the socioeconomic perspective as well, because if you look at where 90% of the people who get their information about the vaccine, most of them get their information from their pediatrician or their own family doctor, which then inspires the question, do you have a pediatrician or do you have your own family doctor? If the answer to that question is no, then there is a large, major source of verified, validated information that you're not going to have access to. And so then you're relegated to picking up your information from other places that may or may not be as trustworthy as that. And so there are a multitude of challenges. And we know that in this country, even before the pandemic, that having access to certain things like regular insurance, having a regular doctor, and all of that type of stuff were compounded issues inside of the BIPOC community. And so the church is one of those institutions that have existed throughout the entire time as a place of comfort and trust. And it makes that bridge, if you will, to get us to the place where we can begin to have that conversation. I myself was more of a skeptic, I think is the word that was used initially. I didn't want to be first, but I knew that I wasn't going to be last. And once I had received enough information myself, I was the first one in line at our own clinic to roll up my arm and get the vaccination and let everyone else be able to see that this is indeed what we're doing. I do like some of the questions that are coming across on the chat, because it may not necessarily be just about education. I think education is, I still think that education is the answer, because people need to know, they need to have the appropriate information. But the ones that are responsible for other people, they have an additional responsibility to stay educated. The church is one of those places where we are responsible for other people, and we have an opportunity to be able to look after, care for, and reach out. I think that the church, we have reached out particularly to our county governments, to our hospital system. I've invited and had doctors come to Sunday service on Sunday and had them talk to the community, where we stopped everything else that was going on just so that the people in the congregation could ask questions, and whether they were in person or whether it is Zoom, because even in the church, we've had to go to more of a hybrid model. And so if those questions came across, we had doctors on hand, both during the service and after, to be able to answer those questions. And whether they were mythology or whether they were real concerns, those questions were fielded. And what that did is that brought a level of trust. And the doctors weren't hiding anything, and they were very comfortable with being able to be there and answer those questions. I wanted to, and I think that our county system and our collaborative healthcare industry for working with us in order to be able to do that. And we have tried to encourage other congregations to be able to do the same thing as well.
And you've said you've noticed a huge difference in people opening up to getting vaccinated because of those grassroots conversations.
And absolutely. And what has happened is that now those individuals that perhaps were hesitant at first, they're the first in line for booster shots, because they've been able to see the benefits. In my line of work, unfortunately, I get to see the results when we don't follow those things. And I've had to funeralize a handful of individuals for whom that life probably could have been saved if that information was paid to. And what we also have to take into consideration is the continuing fallout effect. When we lose a loved one, that's trauma. When we lose someone close to us, that's trauma. That begins to have effects not just on the individual that has passed away, but on every person that they're connected to all the way down the line. And so what we have begun to see is the continuing rolling effect of losing people in a way that is somewhat preventable. And that is never really that's not a good death, I guess, is one of the things we can say in the business, because it's preventable and it's unscripted. And so because of that, we have different things that we have to now deal with and bring into the forefront of our conversation. So we continue to use the efforts that we have in place, and as well as continuing to educate, continuing to spread good information. It's like fishing. You can't cast the line out one time and reel it in and think that you're done fishing if you don't catch any fish. You have to keep throwing that line out, keep casting that vision out, keep casting out that message, and allowing that message to land where it can in order to do the work that it can do.
Yeah, great. Some of the themes I'm seeing coming through the chat are just kind of open questions of why do people in more rural communities just in general seem to be more skeptical of the vaccine than in urban areas? Uni, I'm trying to ask that to you. I mean, like I was saying in the introductions, you're a third generation dairy farmer. You've lived in rural Minnesota for a long time. You and I have talked on the phone, just anecdotally, some of the conversations you're hearing in your communities. Why do you think there is so much more skepticism maybe in smaller communities than in larger metro areas?
Well, your guess is good as mine. I just cannot understand some of the people with what they come up with or the information they get, that they don't listen to reputable news sources. They listen to some misinformation and then they believe it. And I just do not understand that, because you can't argue with them sometimes. And it just boggles me why, because we were always, in our family, we were always raised to value education and have critical thinking of issues. So, but I think if you just talk to them about, like the lady I know said that she had all these ideas that I don't even want to repeat, but, and I said to her, well, I've worked at the clinic and I see what they bring in and I'm amazed at the, well, she said, they don't know anything and da, 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 da. I said, I see what the knowledge is there and I'm just in awe of it. If you see it every day, well, she didn't know if she believed me. And she had her own opinions. And I took in, when my granddaughter, who's 8 years old, when they made it that they could, they okayed that they could have their vaccinations. So I went with her and my daughter, and I got my booster, and she could see that I got my booster. And then she was willing to have her first COVID shot. So I don't know. And all of my grandchildren have been vaccinated, my husband and people I know. And I very rarely ran into people, but we do have a man who delivers our fuel for us for our tractor farm. And he told my husband that he was going to die before he got his shot. And he was just like very argumentative about it. So you can't even go there. You can't even say anything to him. And I wanted to say, well, then when you get sick, don't go to the hospital. Just stay home. But my husband said, I better not say that.
But those
yeah,
are the candid, things you hear from folks,
I hear arguments, and then I'm just bamboozled. But
yeah. I'd like you to just share a little bit more. In your introductions, you talked about getting the polio shot and how that moment has stayed with you all this time. Just talk about, how that moment is similar to kind of the circumstances we're seeing today in your eyes.
It was just like this rejoicing. I mean, we all were loaded up. All the children in the doctors and the nurses came to the school, and this was in our school district, and I'm sure it happened in all the school districts. We were let out of class. We went to the gymnasium. We got in line and we got our shot. And it just made such an impression on me that was because it was polio. And it was new because it's been in the news, all of these people who had suffered so much with polio. So we got our shot. And even after that, I have gotten smallpox, mumps, rubella. My parents have taken us in, and we never questioned it. Because it was effective. We didn't get polio. My mother's sister was handicapped. She got polio as a child. And so I think that's why my mother was so adamant that we get the vaccine. And we did not have any instances of polio in our family after that. Because it was just like a weight that was lifted off of our, but I remember that because I'm a baby boomer, and I remember when it was just new.
Yeah.
Just delivered.
Right. Tim, what keeps you up at night thinking about, running a county and kind of where we go from here? We know this virus is not going away. It's just like you said, you mentioned in the beginning, it's causing so many disruptions. What are some of the things that keep you up at night?
Well, that would be a whole nother webinar, Christine. As it relates to COVID, though, I think it is that vaccine hesitancy is hard. And isn't that the whole purpose of our conversation today? I don't want our listeners to think that the six of us have all the answers here. If we had the answer to get vaccine rates up into the 90%, we'd already would have done it. What I do think is you can move the needle. And I still believe we can move the needle. And how do you do that? Well, I think it is through persistence. Facebook is a place where lots of information is exchanged, not always good information. We have been more direct in our Facebook posts We have a Facebook page, and we will have folks that will post something that we do not believe science supports or that is supported by the evidence. And we don't argue with people, but we will post a link to what we consider the right information. Understand who are the trusted messengers here. And so there's a question in the chat about whether the full page ad taken out by hospital CEOs makes any difference. I can tell you that I believe it does. I think doctors talking about this, and Pastor Alberts made an excellent point about trying to get family physician connections for folks who don't have family physician connections to have access to that information from the most trusted source, doctor. Nurses, who are the other trusted sources? I don't think we think people believe them, but they actually do. The CDC is still a trusted source of information. So is the Food and Drug Administration, state departments of health, county departments of health. And these are kind of in priority order, if you will. And then maybe finally, local government officials. And so how do we get folks connected to that information? I really appreciate Andrea's that approach of the conversation. I think that's also part of it. Not calling people dumb because they didn't come to the same conclusion I came to. It's irrelevant. And it's the here and it's the now. And it's the what we got to deal with. And so I think that education continues to be important. I think persistence is what's going to get rewarded here. We are seeing progress in greater Minnesota on vaccination rates. In Crow Wing County, I can tell you we're just about to 70% of the 16 plus population who have been vaccinated. It matters. And I like to think that it's sometimes the Lake Country Cares thing that we did, the links to Facebook that we did, our connections to our area hospitals. We're having lots more conversations between area hospitals and public health than we've had in decades. I think it's this constellation of small things, and we're going to move this needle one conversation at a time. That's a daunting prospect, but I think that's kind of where we are right now. And so persistence, don't give up. Keep talking about the conversation, even though I know we're all sick and tired of talking about COVID. But if we're going to move the needle, we have to keep gently having those probing, good listening conversations with people. I think that's how minds are changed.
Cindy in the chat says, I vaccinated 3 first-timers today at our walk-in clinic. When I asked why, it has been because of employers mandating it or they're wanting to travel.
We'll take any reason.
Absolutely. Andrea, there was another question in here basically asking about, at what point will insurance companies start adjusting the insurance rates on those who are unvaccinated? And we've heard that kind of nationally, at what point, obviously the hospital beds are totally filled. There's people having heart attacks and other issues. Just kind of reflect on that. Obviously, I'm not asking you to weigh in specifically on that question, but it must be so frustrating to see people coming in with urgent needs and they have to wait in the ER for potentially hours before they're even seen.
It is frustrating to see that. That doesn't mean that we're not going to take care of everybody. I just want to put to bed some of the myths that people say unvaccinated people are not being treated at hospitals, because that's not true. Unvaccinated people are being taken care of at the hospitals. It's frustrating to have longer wait times. As far as insurance goes, I don't know. I think that's going to conversation that's going to continue to evolve over the next few years. Couldn't necessarily speculate on that. But I would like to reflect on something that Uni said about the polio vaccine. I have a background in the military, and when you go in the military, I graduated anesthesia school right after 9/11, and you're told you need to get the smallpox and you need to be protected against anthrax and other things. And I will tell you, I was scared, and a lot of people were scared, and we didn't know. But we did it because we wanted to keep ourselves safe and we wanted to protect other people. And I have a feeling that with the COVID vaccine, people are scared. And that's emotionally daunting on someone. What ifs? And it's okay to be scared. but it's also okay to have courage to overcome that emotion as well. So I just encourage everyone to listen and to have that conversation and know that we are doing our best to take care of everybody.
Yeah. Pastor Alberts, you had mentioned before that you were still convincing people as they were getting the needle in their arm at one point, and then they instantly, realized it wasn't that bad. Just kind of talk about that a little bit more. I think that's a very, interesting image to think about.
The hesitancy situation is real, and there are real fears that go with it. The fears, they go from something as simple as being afraid of needles, all the way up to really just not believing in the medicine or thinking that there are, any number of mythological things going on with the medicine and the research and stuff like that. And you have to understand that some people need, there are different needs for different people. I want to run off a couple of things if I can real quick. From a faith perspective, because I know the religious community is a bastion for some individuals to kind of hold their ground. I want to use a religious exemption to not get that. Well, from a Christian perspective, from a Christian faith, the Bible teaches us that faith without works is dead. And if you have faith that you're going to beat this thing, then your reasonable work, the work that has to be done, is the vaccine. And you have to get the vaccine in order to be able to realize the hope in the faith that you have. We use scriptures and we use different things in order to support the background that we have and the works that we have. But we have to be responsible for each other as well. Being a brother's keeper or being a sister's keeper is a reasonable service. There was an individual that was terrified of the whole thing, but they trusted me. And I said, I'll go with you the whole way. I will be with you I'll meet you at the door. I'll walk you all the way, through the process. And I've made this absolutely available to almost anyone because this is how serious this is. This is life and death. And so holding their hands, they're shaking, they're terrified, but they trust me. They trust the studying that I have done, the consuming of the information that I have done, the willingness of myself to be able to participate in this. And by the way, that was my wife. And so that hesitancy is real and it's not very far away. And even though all of the things going on are difficult and we've got these real fears that are going on, there are ways to be able to get around there. Some of it is closer to home than what we think. I like what Tim has said already, in that there's really a spider web of things that need to be done in order to make sure that we get this vaccination out there. If we continue to hang our hopes on one way of solving this problem or one way to be able to get this done, we're never going to overcome this thing. We have to make sure that all 6 of the people on this panel and all 200 of us that are in this session go out and continue to spread and do our part about advancing the conversation. Don't grow weary in well-doing. Don't get tired of doing the right thing, because the right thing is keep talking about it, keep spreading the right information, keep sharing. One of the biggest pieces of advice that I can give to somebody is that if you don't know it for sure, then don't say it. If you're not sure about it, then don't say it. Because that's how inaccurate information is spread. That's how rumors are spread. We want good, detailed information because there are people that are out there that have a justifiable reason for being afraid. They have a justifiable reason for being concerned or for being hesitant. And what they don't need is, somebody else muddying up the waters with their own inaccuracies. What we need is those individuals who are committed to going out and finding the truth and bringing that to the people that are really looking for it. Are we going to get 100% of the people signed on to this thing? No, but I think, unfortunately, this week we hit 800,000 deaths in the United States from COVID. That is an astronomical number. We have lost more people to COVID than we did with all the wars combined in this country. and it's unnecessary. It's unnecessary, and it's real. I don't want to bury anyone else, not to COVID. I don't want to bury anybody else. I don't want to bury another child to COVID. I don't want to bury another individual who, for the lack of an education in the process or an opportunity to be able to reach them, lose their life. This is preventable, and it is our reasonable work to keep trying, to keep spreading it out, to keep getting out there, to come alongside of each other when we do have partners. I work with law enforcement, I work with the fire department, I work with the paramedics. We all have an understanding of how sincere, how real this is, because when you can't breathe and you can't talk, there's not going to be anybody there to speak for you. So we've got to do all of these things all at the same time in order to bring about the change that we know we can see.
Another perspective from the chat from Brian. I live in rural Minnesota. I've seen people on both sides of pro-vaccine and against the vaccine. I myself am vaccinated. What I hear from employees is that when COVID came out, our politicians made COVID or the pandemic almost like a circus. Many people do not have trust in our government. Also, we have a COVID vaccine after a year where we don't have vaccines for many other illnesses that have been researched for many years. Chief, you talked about this in the beginning, how this has been politicized, and that makes it really hard to navigate. As someone who's influential in the law enforcement community and in your own community, how do you strive to be a voice of reason on this topic?
So I'm a faith guy. My faith drives my moral compass. And I hope Pastor Jim appreciates this when I say, I can't touch it. I can't put it in a vial. I really don't know if it exists. I'll figure it out in the end when I actually show up at the gates of heaven, hopefully, if my deeds are good. But it's non-scientific. I can't put a chart to it, right? But we believe but we all have a faith. It doesn't matter if you're Christian, Jewish, Islamic, whatever. You all have a faith in something you can't really touch or see. And so when we talk about the skepticism to it, here's part of what I think the problem is. If you get vaccinated, it doesn't guarantee that you're not going to get it. It's not guaranteed. You might still get it. Does it reduce the chances that you get it? Well, we don't really know. We haven't taken 100 people and put them into, a sterile tank and give one person the shot, or 2 people or 5 people a shot and then put, COVID in there and to see who got it and who didn't. Will it have an effect on how severe that your symptoms are, or whether you end up on a ventilator or not? I would hope, and I believe that it would. When I put it in more of a tangible state, I was in that generation. I've been around for 31 years in this business. So I'm going to say that when I was first in this business, we didn't have bulletproof vests. They didn't exist. They came into existence from the time I started until today. And when they first came out, we were skeptic. It took about a decade before they became standardized. That the proof showed that it saved lives. And it took about a decade before every cop wore a bulletproof vest to go to work. Until then, there was a large number that didn't believe in it. And it had to be proven to them. But today you won't see, an officer go on the street without it because they now have the belief in it, right? And so when you look at the issue as a whole, there's a level of just pure faith that you have to take. And when you do, when you do get it, like that bulletproof vest, I have faith that it'll improve the probability that I survive. It's not going to guarantee it. Depends on, what bullet comes at me and where they hit me and everything, a lot of different factors. But I have faith that it will improve my survivability. And I think this is a lot like that, just putting it in kind of a more, real scenario. I think this is a lot like it. You have to have some faith in the fact that even though you can't touch it and you still might get it, you have the faith that the probability is that you'll come out of it the other side better than you would have if you wouldn't have it. But there is no 100% guarantee anymore that if a bullet comes at me with a bulletproof vest, that I'm 100% guaranteed that I'm going to survive it. or that at the end of the day, there's 100% guarantee that all of us are going to end up in the same, place based on our faith. But there certainly has to be that level of faith that drives us to say, I want to improve my probabilities without guarantee.
Yeah. And just to follow up, this is from Barbara. Chief Hoppy, my son is a police officer. She says he's vaccinated, but others on the force are not. Their chief just got COVID this past week for the second time and was very ill. I appreciated your delivery on how officers think and work. So do you think it's kind of personal, anecdotes like that that might help convince at least one more officer or firefighter or paramedic to get vaccinated?
I don't think it matters what the issue is, but when we can personalize it and it affects us directly, we hope that that's where those relationships and that credibility, like Pastor James says, that he has immense credibility with his faith community and the people that he works with every day. He's far more influential than I am with the people that are in his circle of influence, just like all of us are. And when we see these personal stories about how people were affected and how they made it through, they got it, they didn't get it, they're vaccinated, they're not vaccinated, we just hope that sharing those experiences really helps influence people into reaching out to the medical community, your doctor specifically, who knows your medical history, who can help guide you and give you guidance into what your best decision is. Don't rely on the political polarization that's happening in Washington, D.C. as we all fight over who's right and who's wrong and this and that. And, really go to the source of who can help you make the most educated decision and the people that you trust. Social media, I'm a big proponent of social media. I mean, we're known because of our social media, but I'm going to tell you, it's entertainment. It's not news. It's not vetted. It's not factual. It's an entertainment platform for all of us to enjoy, but certainly not the premise that I draw my legitimate information from. Do your own research. Use your healthcare providers. They are the professionals. They know it better than I do. Use your faith community. Have some faith in it, and let's all try to get through this together.
Yeah, I feel like people are getting uplifted as we go on. I just wanted to go around the panel quickly and answer this one question, because we know, as we said, this is not going away. We're possibly facing a new variant that we don't know a lot about. People are really fatigued with this pandemic. I'll admit, I am too. How do we get people to care? Andrea?
I think it's exposure. Keep spreading the word. Absolutely, over and over and over again. The more you hear it, the more normal it becomes. I agree. People do have a distrust of the government. And so it's those grassroots efforts that we have in each individual community. Like Paul said, in my circle of influence, this is what I can do to convince or to educate. And a leader at my hospital, she said, lead by example. When you go to the grocery store, wear your mask. When you go to the gas station, wear your mask. And by doing those things, people will see you and do what you do. They have to see it sometimes to believe it in that respect. So I think people are scared, and we just keep spreading the word.
Uni, how do you think we get people to care, people in your community to care about this and do the right thing? Oh, you're muted.
Just like Andrea said, to set an example and just look like to me, if you wear a mask, you're saying, I care about you and I care about me and I care about that we watch out for this and we protect ourselves. And, that gets in the back of your mind. Whenever for a while there, they relaxed the mandate, and now in Rochester, they have a mandate. So I went to Rochester because in our local area, we don't have a mandate. Go to Rochester and I saw everybody wearing a mask and I thought, I should be wearing my mask. So I put on my mask, but nobody asked me to. But it was just like, it was an example of everyone else being conscientious. So I think that's what we can do. If we can't preach to everybody.
Yeah, Tim?
I think that most people haven't stopped caring. I think they're tired. I think they're afraid, but I don't think they've stopped caring. And if I thought they did, then I got to leave this job. because I'm not going to be any good to anybody. I see still in public health circles, people leaning in. I still see in hospital circles, people leaning in. I still see those commitments to the greater good. And I want to draw a distinction between vaccine hesitancy and being anti-vaccines. Anti-vaccine is not new. And I saw a question in the chat. I'm old enough as well to remember getting the polio vaccine. But I would tell you that I was young enough that the fight over the polio vaccine wasn't on my radar, but there was. Going back to 1918 and the flu pandemic then, there was a lot of skepticism or hesitancy or anti-mask, or a pandemic is never going to be as sanitary as history will make it appear. It's okay. We got to keep trying. And that's what happened then. That's what's going to happen now. We're not going to give up. You can't. And I think because all of us care very deeply about an avoidable death. So we're going to keep caring.
Pastor Alberts?
Yes to everything that everybody else has already said. And I will add, you do everything you can do. Again, this is about life and death. And so you do everything. I am of the belief that I can preach to everybody. Of course, when people, when my kids think that their eyes roll, because I'll get preachy on things, but I think that it's necessary, because if we understand what's at stake, if we understand what the cost is, then those of us that can should. I want to, take Chief up on the idea that, these platforms that we have, we all walk around with these devices and stuff, and some of us are more prolific in our usage of them than others. And it's not going to hurt you to drop a link in your chat, on your Facebook, in your Twitter feed, in your Instagram, that connects to accurate information, a CDC poster or flyer, something from the Minnesota Department of Health or something along that lines. Just do that once. And if all the 200 people that we had on here today did that, imagine the connections that we have to be able to spread out that positive information and get it to permeate just a little bit further. What we have to do is everything. And I want to make sure I say this too. Those individuals who are not getting vaccinated who are not vaccinated right now are not against us. They're not enemies. They have their own reasons. They have their own understanding. And so what we have to make sure that we do is don't judge. Well, we don't want to judge anybody or demean anyone because they have a particular position on where they stand on this medicine. It is a real situation. It's a real circumstance. And there are real considerations to keep in mind. We are doing absolutely everything that we can in order to provide the information that people can use to make those clean decisions. But we also know too that there are real reasons why they're not already vaccinated, why they're not already on the other side of that particular conversation. And we've got to give them the time, the space, the patience, the love to be able to allow them to come to that place. And we have to do our job on our end to continue to put the message out there, to continue to be a resource when they're ready. I'll get people coming into my office right now that says, okay, Pastor, I'm ready for my vaccine. We had that conversation a year and a half ago. But okay, you're ready, I'm ready, come on, let's go. We're gonna go and you're gonna get into my vehicle, we're gonna go down there, we're gonna go get the vaccine. I'm going to sit with you while you get the vaccine done. I'm gonna talk with you while you're waiting for your 15, 20 minutes to make sure there's no adverse effects. And in 2 weeks, we're coming back and doing the same thing. And it is being that ready in order to make that change and letting people know that I am here for you. This is no different than any other more tragic, more death-defying thing. And we have to make sure that we keep that in mind as we are pushing the message. And I love what Tim just said, that history sanitizes the efforts and the work that went into a successful vaccination push, no matter if it was 100 years ago, whether it was 50 years ago, and it was never as clean as history allows it to be. So let's keep that in mind, that we are doing the work right now for our time, for our period, and we hope that in time coming, history will look favorably upon us that did the work to save the lives of our fellow human beings.
Right. So where do we go from here? What are some small actionable steps that we can take as community members and influential leaders like yourselves to have these tough conversations and we rework the messaging on vaccination uptake? Chief, I'll start with you.
You know, I wouldn't be right if I didn't add a little humor in on this. So Pastor James, I'm going to bring my fleet of squad cars and see how many people I can get to voluntarily jump in the back, and then I'll drive them. You know, but on a more serious note, he's correct. You know, just sharing, having these difficult conversations, right? You know, non-controversial conversations, influential, without blame, without you know, trying to demean people for their belief systems, you know, but just having those conversations. I think there's too many times that, you know, we avoid the politics question, right? Because we don't want to get into a heated dispute with our friends because we have different visions or interpretations of politics or whatever it may be. And I think this is similar to that, where we can just simply have the candid but respectful conversations and hopefully educate, you know, based on factual informations rather than emotions. And then let people digest that over time. And I love the fact that you know, Pastor James said, you know, somebody came back a year later and said they were ready. Everybody's ready at a different point of their life, in a different time frame of their life, and the patience to let them make that decision in a respectful manner, I think is great. I think it's a great example of some people take longer to get there, but they got there. And I think that's the important part. So, you know, the courage to have the respectful conversations, unemotional, simply just a healthy conversation, and hopefully one or two people along your journey will come to a conclusion that's beneficial for them, regardless of what the time frame is. It doesn't have to be tomorrow, but we hope that they make a decision that's great, that's, you know, that's influential to the greater good. That's all I can say.
That's great. Tim, where do you think we go from here?
Well, you know, I help to lead a public health agency, and so I don't suppose there's much surprise which side of the question I come down on. And I think that it gets to be at a certain stage. This is a leadership question, and leadership is really easy when everything's going my way. Leadership is no fun when things are controversial. Do it anyway. Do it because it's the right thing to do. Do it because it's your true north. Do it because it's what you think God put you on the face of this earth to do. If not you, who? If not now, when? We have to lead on this. And for, I think, all of those who are listening on the webinar, it is in your circle of influence. Do it anyway. I get that you're going to get pushback for that. You can read Crow Wing County's social media posts, and there are people who are not happy that we post evidence. There are people that are not happy that we won't stop talking about vaccines. There are people who are not happy that we still think washing hands and wearing face masks are a good idea. We're doing it anyway. I'm trying not to judge. I'm not responding. We're not engaging in a negative debate. But we are ready, willing, and able. We still hold clinics. We still post evidence. We still talk about the effects on the healthcare system. We still talk in settings like this for anybody who will listen about it's one conversation at a time, you know, and so be bold, lead.
Uni, just any lasting thoughts of where we go from here, how you have those tough conversations, urgent conversations?
Well, I just saw a question, just be patient and keep after them and just say you have to do that. But I saw a comment about that they thought it was many people thought it was so suspicious that there was a COVID vaccine after only a year. But they don't know that they've been studying the SARS infections since the 1990s. And all that information that I've learned was the basis for developing the COVID vaccine. So it wasn't just a year, it was many, many years of research that they have been doing. And I guess one of my fears is that by not getting vaccinated, we have the Delta variant, we have the Omicron variant. How do we know that we won't get a more severe variant in the future that nothing will work against? That is my fear.
Yeah. Andrea, you've been saving lives since the beginning. You know, a commenter said, my frustration is while people are getting ready, people are dying. You're all much more patient than I am. What do we do from here? If we can get one more person vaccinated, maybe from this conversation, that does make a difference.
I agree, just one person. And again, it's that respectful dialogue. It's a lot of listening. Sometimes I will open the conversation with someone saying, I want you to listen with the intent to be influenced, and just see where it goes from there. Educate, if it's your neighbor, if it's in the grocery store, anywhere. And again, it's going to be on their own time if they choose to do it. You can't push, you can't force. It doesn't work. And bring the personal touch to it. You know, in these rural communities, it's family. It really is. And I don't want to lose anybody else. So keep the conversations going. Thank you.
Great. Well, I'm going to wrap it up here. This has been an awesome conversation, really dynamic, very diverse, just great perspectives. And I really hope people tuning in appreciated that. So much thanks to Tim, Andrea, Uni, Pastor Albers, and Chief Hoppy for joining us. I also want to thank the COVID Collaborative, the Center for Rural Policy and Development, the Minnesota Farmers Union, and the Minnesota Farmers Bureau for helping us put this together. As Julie mentioned at the top, this recording will be available on the Center for Rural Policy Development's YouTube page, so be sure to check that out. And again, thank you everyone for joining us this evening. Hope you all have a great night. Goodbye.